Hello, my name is Michelle LeBron. I have been a registered nurse since August 2005. I currently am the VP Chief Nursing Officer for Advent Health DeLand. I started my career with Advent Health immediately after nursing school in a progressive care unit. After 2 years, I transferred to the intensive care unit. I spent most of my bedside nursing years at Advent Health Orlando in the CV ICU. It was here where an amazing leader approached me about my interest in leadership and encouraged me to apply for the assistant nurse manager position. I was an A&M for 2 years and then became a nurse manager for an intermediate care unit or step-down ICU. I led a team of 83 employees. In the next 3 years, I was able to decrease supply costs, exceeded budgetary goals, and provided a world-class patient experience for those we were privileged to care for. I went on to become an inpatient director, where I led the critical care service line, which consisted of the emergency department, intensive care unit, and the progressive care unit in the Central Florida North Division. When my mentor and CNO of DeLand was promoted to Chief Clinical Informatics Officer in 2020, I too was promoted to Chief Nursing Officer. As an executive, I do not provide direct patient care, but happily assisted my nursing teams in the ICU at the bedside during the pandemic. I applied to Advent Health University's DNP Organizational Leadership Program for many reasons. The first and most important reason to me is my own personal sense of accomplishment. While I do not want to pursue a lifelong career in research, I welcome the credibility of being an expert and researcher in my field. The research and study required to complete a doctoral program will provide me with the opportunity to advance my skills in writing, reading, research, and analysis, which will benefit me academically, professionally, and personally. My vision is to be a hardworking, dedicated, disciplined, and focused nurse leader with higher education and knowledge that will enable me to provide superior quality healthcare and lead and transform change while servicing the community I work in and society at large. My area of interest for my DNP is sepsis. Sepsis is a life-threatening condition that occurs due to a dysregulated host response to infection. Recent data demonstrates that patients with sepsis have a significantly higher readmission risk than other common conditions such as heart failure and pneumonia. There is also a significant economic burden associated with sepsis readmissions, not only for the hospitals, but for the patients and their families. There are many studies that have been conducted regarding the use of disease-specific education, such as a zone tool, to help reduce the readmission rates. I would like to implement this on a med-surg unit and utilize the teach-back method to ensure understanding as compared to units that do not use zone tools to see if this helps to decrease their readmission rates within this patient population. In my role as CNO, I must collaborate with others on most anything that I do, not only with the nursing teams, but with my colleagues, doctors, ancillary departments, patients, and their families. Most recently, our hospital opened a transitional care unit. There were multiple meetings with finance, operations, and contractors over 13 months. This also required me to meet with key stakeholders in and outside of the facility to ensure the proper equipment was purchased and training was completed. Plans were made and changed several times to adjust to delays or supply shortages as this unit was being constructed during the height of the pandemic. Flexibility and a good change management process was necessary every step of the way. Communication was also key. We were able to open the TCU in September of 2022 and have been able to provide a much needed service to a community that did not have a service line of this kind before. I have completed my MSN in Nursing Leadership and Management and my MBA in Healthcare Management via asynchronous learning environments. I value distance learning and do not agree that it is a requirement to be physically present with professors and or students, as I believe that the same goals can be accomplished if you set your mind to it. Completing coursework on my own time actually allowed me to sit and work through lessons and tasks in greater depth as there was more flexibility. If I encounter problems in an asynchronous learning environment, I will first evaluate what it is that I'm struggling with. Do I need to have better time management, or should I reach out to another student or the professor for clarification? I know that I can also take advantage of the many student services resources offered by AHU if needed. I am confident that I will be successful throughout this graduate program. I am very fortunate to have a supportive family that has encouraged me to apply and pursue a doctoral degree. My two adult children are also in college and know the hard work and dedication it takes to obtain an advanced degree. My oldest actually just started residency at Advent Health Orlando in internal medicine. My husband and two children are my biggest fans and will support my journey of managing deadlines and the extra time away I will need to complete assignments. I am also a proponent of completing tasks early. I am not one to leave things for the last minute and see this as a great trait to possess on this journey. I work as a chief nursing officer in a small community hospital and am lucky to be able to manage my own schedule. I have discussed my decision to obtain a doctoral degree with the president and chief executive officer of the hospital, and he also supports my decision wholeheartedly. As an employee of Advent Health, I strongly believe in our mission of extending the healing ministry of Christ. It is because of this mission that I have remained with Advent Health for so long. As a Christian, I share the same beliefs, values, and service standards. As we continue our journey of whole person care, treating the mind, body, and spirit, I feel that it is imperative that we all endeavor to provide everyone we are given the opportunity to care for the same exceptional quality care, regardless of where they come from, what they do for a living, or the color of their skin. We were all made in the image of God, and my role doesn't change as a DNP student. It enhances my efforts to continually demonstrate Advent Health University's mission of healthcare as a ministry. Thank you for this opportunity.